Are being given first access to the vaccine for coronavirus. But even in these settings, there is still some vaccine hesitancy. Medical reporter Liz Bonus explains why.
Hundreds of frontline workers are stepping up to get this vaccine, but many say they still have questions and are choosing to delay. Those who are getting it say they want to be able to share with patients, friends, family members that it is safe. And there is no better way to do that than to step up and get that vaccine themselves.
One of those, Dr. Brett Casella. He had 2 injections a few months ago as part of the Moderna vaccine trial.
And it turns out I had had the placebo. So then I was offered the chance to get the vaccine and continue to be followed in the study, which is all part of the research plan. So I did that. So I got vaccinated stage 1 yesterday.
One of the interesting things that I'm hearing is there certainly is a big desire among physicians, it seems, to step up and get the vaccine. But I have heard with other frontline workers, not so much. Do you hear that as well? Do you know why that is?
It's not fully FDA approved yet, and some people may be wanting that final seal of approval. And so, for example, at our institution, it's not mandatory to get it. And I think that's reasonable.
He's not the only one. As research continues in settings such as this long-term care community, when offered the vaccine, the number who said yes to getting it?
From residents, about 100%. From staff, about 55%.
So they, too, say they will lead by example and continue to encourage through vaccine education. That said, especially for those who work in close contact with others at risk for COVID-19, well, personal protective gear does help. Dr. Casella, who's also the Chief of Research Services at Ohio's UC Health, says this. Like driving without a seatbelt, with the vaccine, you may want to weigh the benefit versus the risk.
But if you're going to have an accident, you sure as heck want a seatbelt on and have an airbag. And so the vaccine is like that, right?
Now, when you're weighing those benefits versus risk, experts remind all of us to consider not just the immediate, but the long haul. They say many of us survive this virus, but can suffer problems after it. And those can be everything from memory loss problems to headaches to heart risks. I'm medical reporter Liz Bonus. We'll throw it back to you.